My name is Reid Groman, and I'm one of the critical care specialist veterinarians here at VCSG, responsible for caring for the most critical and critically ill sick patients we have at the hospital. So here as a specialty, we have emergency and critical care as a subspecialty here at VCSG. There are 3 of us clinicians here at VCSG that have this specialty certification. And we take care of, as I said, the most critically ill patients in the hospital, those requiring blood transfusions, those requiring continuous oxygen, those requiring continuous blood pressure monitoring. The most critical traumatized patients are those with metabolic diseases as well that are requiring essentially 24-hour care that exceeds most other services' ability to do so just because of the number of people just available to take care of those patients. What's unique about VCSG is not only do we have an exceptional group of people and fairly intensive monitoring equipment and therapies, but we also function as a single unit. So although each patient has a doctor assigned to it, we work as a hospital, and we all talk about each other's cases and participate in the care of each other's cases to ensure the best outcome for our patients. We have a fair number of patients that are either from trauma or toxicity that require blood transfusions, and we're very fortunate that we often have more than adequate amount of blood here in the hospital because we have our own in-house blood bank, which is a resource that we make use of a great deal of time that is not available at most animal hospitals that I'm aware of in the area. So in terms of the care that we specifically provide in the hospital that's unique to our area in the hospital is various methods of oxygen supplementation to patients. Most recently, we acquired a machine that delivers high-flow nasal oxygen. It's a machine called a Vapotherm that is used in human ICUs as well that enables us to deliver a high concentration of oxygen at a high flow that increases patient comfort and makes it easier for them to breathe. As I said, we also have the ability to use blood to give blood transfusions here at the hospital, provide other means of oxygen supply. We have the ability to measure direct arterial blood pressures, which means that we have a catheter inserted in the dorsal pedal artery, and we can measure patients' blood pressure from minute to minute and from hour to hour as we need to do it. We also have telemetry, so we can observe a patient's electrocardiogram and their pulse oximetry in real time. It's displayed on a large screen in the intensive care unit, and we can have the values up there for any number of patients, from 1 to 4 patients. We can have continuous monitoring variables that we look at fairly frequently. It's not uncommon for us here at VCSG to perform CPR or cardiopulmonary resuscitation on dogs and cats. I'm proud to say that all of our staff are trained in performing CPR using all the current initiatives that have been published in veterinary medicine. We're also able to offer intensive care to those patients that we are successful with return of spontaneous circulation, that we can provide the intensive post-resuscitation care that these patients may require, which is hours up to days to follow. So here at VCSG, we're very lucky that we all participate as a collaborative service, essentially. So we take care of sick patients on multiple services. We take care of the sickest patients in the surgery service. After their surgery, we'll also help them to make decisions for their patients. At the same time, they help us out. So we'll take care of the sickest of the medicine patients, neurology patients, oncology patients, but we also work with them closely to make sure it's a collaborative effort and a team effort on each individual case to ensure that they get the best possible care.